Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available now on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. And with that, let's begin. Today, we'll be reviewing Terazosin, a drug with effects both in the urinary tract as well as the cardiovascular system. It's classified as a non-selective alpha-1 blocker. To remember our brand and generic, we have our PharmaLink phrase. This is just a quick memory hook that your brain can latch onto so you can remember the pair more easily. At one point, Terazosin was commonly used for hypertension, but fell out of favor when studies linked it to worse cardiovascular outcomes, including higher heart failure risk. Today, its blood pressure effects are considered more of a side effect than a primary use. It may still be used for this indication, but it's considered a fourth-line add-on therapy and definitely not a first-line blood pressure medication. It is, however, still used for benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate that narrows the urethra and makes urination difficult. Terazosin helps relieve these symptoms by relaxing the smooth muscle in the prostate and the bladder neck to help improve urine flow without shrinking the prostate itself. A memory trick to remember these indications, you can think it treats the two T's: tension, high blood pressure, and trouble peeing, BPH. Alpha blocker selectivity is explored later in this chapter and is an important concept to understand the mechanism and side effects of these agents. In summary, Terazosin is non-selective completely and has effects on blood pressure. Even though it is also technically non-selective, alfuzosin has less blood pressure effects given its ability to concentrate in the prostate and bladder. And then we have tamsulosin, which is completely selective and only targets alpha-1A receptors in the prostate. Now, using that context to put it all together, our mechanism, Terazosin works by blocking alpha-1 receptors, specifically 1A and 1B, 1A being in the bladder neck and prostate, and 1B being in vascular smooth muscle. This improves urine flow and reduces blood pressure. Moving to side effects, we also have a mnemonic to help remember these. As we mentioned, Terazosin can cause widespread vasodilation and a drop in blood pressure. Many of its side effects are related to this effect, and you can think terror drops you down to remember them. D for dizziness, where sudden vasodilation can affect blood flow to your brain. O for orthostasis, when blood vessels can't easily constrict on standing. W for weakness, potentially from reduced perfusion and overall low blood pressure. And N for new head pain, also due to vasodilation of your cerebral blood vessels. Terazosin is only taken orally and should be taken as consistently as possible to reduce the risk of side effects. Okay, warnings. We've mentioned orthostatic hypotension, especially with the first dose or dose increases. Although very rare, priapism can occur due to prolonged smooth muscle relaxation and penile tissue. And finally, it should be avoided in anyone undergoing cataract surgery as it can interfere with the procedure. And that's our review. See you next time.